Hi there, a few minutes with neck and shoulders. Making sure to sit well into your thighs, align everything, sit well, bring the hips out, breathe up into the chest, roll the shoulders back, sit back the shoulder blades into the chair to support, relax, take a few minutes off from the desk. Maybe if you haven't already, you can cross over, inhale, exhale, spinal twist. You can spend a few breaths here, inhaling, exhaling. Whether you come back out or you hold, you're going to inhale neutral and come on over to the side. So good 3 breaths on this side. So whether or not you come back again to neutral or just hold yourself into the pose, continue to roll the shoulders back, lifting up, elevating through the abdomen, and using the belly to breathe and take you further into those rotations. So inhaling with the fingers interlaced up overhead, we're going to rotate those palms out. Slow rotation at the top there to open up the shoulders, bringing that up, maybe little pulses. Opening from side to side, breathing into lungs, rib spaces, pressing through the axillary region, opening up the tricep. Bringing your spine maybe into more of alignment. Exhale, bringing it through neutral. Bring those hands down. Tendency to cross one way, so cross the other. Rotate. You work the shoulders. Inhale, elevate, and then so taking a few breaths, same thing, making the adjustments, setting down through the hips, checking your feet on the floor again. Always making sure to wiggle the toes, the feet, they hold tight throughout the course of sitting at a desk, and a whole lot of other things that we're doing throughout the course of the day. So leaning back with my shoulders tucked in, and bring these hands interlocked behind my neck. And gently from side to side, just gonna let the weight of my hands start to rotate the tissue. Inhaling neutral, maybe I'm gonna recross the fingers, drag that hand to the other side. We're gonna warm up the tissue of the neck. This is the trapezius and the fascial tissue, everything from the skin down to the bone. Bringing it all into rotation. So if you continue to look your eyes, you can go a little bit further in the direction of the twist. Under the arm, up overhead, it all creates a different feel. So here I'm going to neutralize, and I'm going to bring both of my elbows forward. Inhaling, leaning up over the back of the chair, whatever you've got available. Open up the shoulders, elongate the back of the neck. Exhale, bring the elbows forward. So taking a few breaths to open, and gently move the hands down the neck, maybe recrossing the fingers, and pulling forward gently on the tissue in the new location. So inhale, kind of straighten things out, get a good breath. Exhale, you're compressing, breathing deep. You can hang out there and take a few breaths, kind of work the hands back and forth in the meat of the neck. This is where the traps and the levator scapula meet, the tops of the shoulder blades. It's always so dense. So you can see, if anybody knows me, I press deeply. So I'm pressing the heels of my hands, crossing my fingers and really dragging that tissue down. Inhale. Exhale, I'm going to pull down on that side to side. I'm going to kind of start to get my thumbs in a little bit. And now I'm rocking my neck back and forth with my hands there. My elbows are moving. Bodies move and twist, corkscrews. So I'm staying low as to not twist and rotate the spine too far. It's more about the movement of the tissue. But later, as things start to open up more, you could start to take bigger twists. Really opening through the side body, opening up through the shoulder. You can see that I will come to neutralize. Bring the other side up. Work consciously there. Because basically you want to feel out all of the connective tissue as you're starting to move and twist the spine if those movements are new to you. Taking the hands just at the base of the skull here. Give yourself a massage at those traps. My chair's bouncing. Feels good. Softening all the way around the ears here. All of this. Attachment points to not only the traps in the back, occipital muscles underneath, but in the front here, this big old strap muscle, the SEM, comes right up through here in this guy. So I'm actually going to do multiple things. I'm going to squeeze here, kind of bring that down. Do that on the other side. Just 1, 2, 3. Be careful there, not quick movements. A lot of vascular, jugular, so veins. I'm sorry, arteries first. Those are veins. So take time. I'm actually breathing because that felt really good. It's really tight. Work hard. So take your time with that. That being said, I'm going to be careful with the base of my hand there, but I'm going to take the whole side of my neck, maybe take place here on my chair, and opening up gently to the side, I'm going to try to get my hand on my neck to try to gently open up the tissues. And this is the back side of my neck, rather than bringing my heel of my hand to the front side too much here. Kind of trying to get that side line to the back line, which may even be reachable there with the thumb. Pressing and kind of dragging that out under the base of the skull. Gentle rotations at the top, only go within your range of motion. You know, you'll probably feel some things cracking around in there if this is new for you. So that was something to the effect of heel of hand to, there's SCM. So I'm going to give it a little lift as I start to come up to take place in, as I was saying, like that side line of your neck where the traps get real tight and then it gets thick to the back, levator scapula. We want to unwind that tissue back that way. And you can really plant that heel of your hand there. And I'll even hang out here for a second and do a couple palm presses right there at the back of my neck. And I'm just kind of twisting and moving around in my chair as to what I think might be appropriate for some visuals. So for whatever it is, these are cheap home movies for my clients. Some anatomical knowledge, real-time action, taking care of myself, doing this to loosen up my neck and shoulders. Okay, so I have pressure here at levator scapula, traps. I can feel some stuff. I could spend some time with my arm relaxed and pulling down on whatever tense tissue you feel there. My thumb is being very delicate, kind of a guide for that tissue in the front, but on the back, it's kind of like a finger rake, dragging that tissue away, right down into the crook of that shoulder. So I started down in here, the bulk of the tissue, bellies, work my way up. I'll pull this tissue around to the side. Breathe deep, open up tissue. I'm right at the seam, getting into the vertebrae and dragging my way back this way, even down. But this one now, I feel like I could come back with a heel press. So change it up, whatever felt good. press, pull, move the tissue gently back. Oh, nice adjustment. Back and forth. So, you know, we're not doing this to be real quick and make adjustments. This is all just stretch, pull, movement, and as things adjust, you know, as things tend to come open, then we get those adjustments. You know, it's nice. You know, tendons and things kind of popping over, popping back into place, bones. So, hands over face, smooth it out, with the eyes closed. Gonna bring everything out and around. Maybe eyebrows, forehead, eyebrows, underneath the eyes, face, underneath the jawbone there. Today I was stopped on the intersection because I had one of my Thai massage tools and I was totally scrubbing my face. And this guy just loved it. So him and his girl, what is that you're doing? So I talked about it for a minute before we had to roll on. But you know, Thai tools will be coming in different versions of this. So I came down in my neck and I'm just kind of giving some assists. All this is good for the arms. Like endurance training, I'm getting the arms up, breathing, shoulder circles. If you need it, take a break. I can keep my arms up for quite a while. Because I know where to support, where to let go, where to hold, and use that, you know, leverage and the hang there. So, because I've been doing a lot of work lately. So I'm going to kind of leave it at that. It feels really good, quite balanced. Check in later. You know, we'll do some more stuff. Thanks. Bye.